Hi, Brittany.
Hi.
Hi, my name's Mariah. I'm a physician assistant student. Is it okay if I ask you some questions?
Yeah, definitely.
All right, sounds good. What brings you in today?
I've had fluttering in my chest since about this time yesterday.
Okay.
And it's really concerning. I've never had anything like this before. I go on a walk every morning to stay in shape, and I go on my usual route, but this time, these new neighbors moved in, and they're really annoying.
Oh, no.
And they have this very, big, scary, yappy dog, and I was just on my walk, and this guy was walking his dog, and it scared me so bad, and ever since then, my heart's just been going like crazy, on and off.
Oh, I'm sorry that happened.
Yeah.
All right, well, I'm gonna try and get to the bottom of that for you. We're gonna go through some more questions that are gonna be specific to that. So you said you have fluttering in your chest and that's been happening for a day?
Since this time yesterday, yeah.
This time yesterday? Okay. All right, so what would you say is the reason that it caused it?
I think I got really scared, and ever since then, my heart's been going crazy.
Is there anything that you found has been making it worse?
When I'm stressed, definitely when I'm stressed. Or exercising, going up my steps is really difficult now.
Okay.
I get really short of breath, so that's new.
About how many steps would you say you can walk up before you feel this shortness of breath?
There's probably only about 10 to the front of my house.
Okay.
And even doing that now is a lot. And it hasn't been before.
Right. Okay, thank you. Is there anything that you've been doing that makes it feel better?
Just laying down and, trying to relax makes it a little bit better, but it's still it comes and goes.
Okay. So do you feel this fluttering constantly throughout the day, or like you said, it kind of comes and goes in waves?
Yeah, it comes and goes in waves.
Have you ever felt anything like this before?
No. Just trying to exercise to not get like this.
Right, I understand. That's good that you go on walks, though. That's awesome. So how would you describe the fluttering in your chest? Is it really rapid? Does it feel kind of heavy?
It's kind of like a thumping pain. It's almost like my heart's beating too fast.
Okay.
But it stays in my chest, right around here is where it is. It doesn't go anywhere else.
Okay.
So.
Are you experiencing any pain with this fluttering in your chest? There is some pain?
Yeah.
Okay.
Yeah, it's pretty bad. It's pretty concerning. That's why I decided I should come in.
Right. Yeah, thank you for coming in. Hopefully we can help you out with this. So for the pain, on a scale of 1 to 10, 10 being the worst pain you've ever felt before, how would you rate this pain?
I'd say it's about a 7. It's
A
pretty
7?
bad.
Is the pain constant, or does that also come and go in waves?
It comes and goes too, yeah.
All right. Okay, and the pain also stays just in your chest? It doesn't radiate anywhere?
Mm-hmm.
Okay.
Yeah.
All right, I'm just going to ask you a few more general questions.
Mm-hmm.
Do you feel like you've seen any weight changes recently?
No.
No? So your clothes are fitting normal, your usual weight?
Yeah.
Okay. Do you feel any weakness in your muscles?
No. Just when I'm trying to go up the stairs, but besides that, no.
Okay. How about general fatigue? Do you feel tired all the time, or maybe more times than others? No. Have you noticed any fever?
I think so, yeah.
Yeah?
Yeah.
Have you taken your fever at all? With one
No.
of those?
I feel feverish. I feel hot.
Okay. Do you find that correlates with when you're having the pain or the fluttering in your chest, or is that at other times during the day?
Just when I get worked up.
Okay.
Yeah.
All right. Are you feeling any other symptoms along with the fluttering in your chest and the pain?
Some dizziness, definitely. Some lightheadedness. And again, the shortness of breath is really bothering me too.
When did the dizziness begin?
Around the same time that the pain started.
Okay.
And you know what, actually, I've been feeling fatigue too.
You have been feeling
Yeah, I
fatigue?
have been feeling fatigue.
Okay.
Yeah.
So you've just been feeling kind of tired, blah, can't really
Mhm.
get the energy?
Yeah.
Okay. And then the lightheadedness, when do you feel that the most?
When I'm trying to go up the stairs and, just roaming around the house now too.
Okay.
Yeah, any kind of exercise.
Is there anything you found that makes the dizziness and lightheadedness better?
Pretty much the same thing, just laying down and resting,
Okay.
trying to calm myself down.
Have you tried taking any medications?
I took some Advil,
Okay.
I think 2 tablets,
Do you by chance know the dose of those tablets?
maybe 200 milligrams.
Okay.
Whatever my son buys me, I take.
And did you take the Advil for the pain?
Yeah,
Okay.
yeah.
Alrighty. So besides taking the Advil for the pain, are you on any other medications normally?
Yeah. I have high blood pressure,
Okay.
so I'm on lisinopril.
Do you know the dose of that?
Yeah, 20 milligrams.
Okay. And how often do you take that?
I take it once a day.
Okay.
Just pill,
Do you usually take that in the morning, at night, during meals?
in the morning.
Morning. And then is that oral?
Mm-hmm. Yeah.
Any other medications?
I'm on aspirin too,
Okay.
because I was diagnosed with coronary artery disease, I think it's called.
Okay.
So I take that as like a blood thinner.
And then do you know the dose of that?
I think maybe 100 milligrams.
Okay. And the frequency for that?
Once a day.
In the morning with your lisinopril?
At night.
At night?
Yeah.
Okay. And then how do you take that? Is that a pill for
It's
oral?
a pill too, yeah.
Alrighty. And then any other medications that you're on?
No.
Any vitamins or like herbal supplements?
Yeah, I take a multivitamin.
Multivitamin?
Yeah.
Okay.
My daughter buys me them.
Oh, okay.
Says it's good for my bones. So.
Do you know what brand they are by chance? No? Okay. Any dose?
No.
The
Just
frequency?
once a day.
Once a day?
Yeah.
Okay. Is that oral as well?
Mm-hmm.
Yeah. Okay. Would you say you're pretty good with keeping up with when you need to take your medications?
Oh yeah.
Yeah? Okay.
Yep. Never miss a dose.
All right. Do you have any known allergies?
Yeah. Penicillin.
Okay. And then what happens when you take penicillin? What kind of allergic reaction do you have?
I get really bad hives.
Okay.
Yeah.
Are they on a specific area or are they kind
Just
of
all over.
all over?
Yeah,
Okay.
it's really bad. Yes, I've had that since I was young.
Okay.
Like maybe 10 or something.
Okay.
So it's been a long time.
When was the last time you've had a reaction?
Decades ago.
Okay.
Yeah. No, I try to avoid it.
Okay. Any other allergies?
Pine nuts.
Pine nuts, okay.
Mm-hmm.
And then what happens if you have pine nuts?
My throat closes.
Okay.
Yeah.
And then what year would you say you had that?
I found that out when I was little at a cousin's birthday party.
Okay.
Maybe 5 or 6.
Okay.
Yeah.
So the last time you had a reaction was a while ago.
Yeah.
Okay. Any other allergies?
No.
Do you have any seasonal allergies, just congestion, sinus pressure?
No, I'm pretty good with that.
Okay. All right, I'm just going to ask you a few questions now about your past medical history, if that's okay.
Sure.
So for your childhood health, how would you describe the general picture of your health as a child?
I was pretty healthy as a child. It was pretty like normal childhood, but I did have chicken pox.
Okay.
I think when I was 5. And that it went away on its own. So we didn't do much for it back then, you know.
Yeah, okay.
I don't think I really had anything else. I was a pretty healthy child.
Okay, any significant like trauma or injuries?
Nah.
No? Okay. And then since then, have you had a vaccine for chickenpox, or have you seen any signs of like shingles?
I haven't seen any signs of shingles, but I don't think I got the chickenpox vaccine.
Okay. Alrighty. And then so as an adult, I want to talk about some of your medical diagnoses. I know you mentioned having hypertension.
Yeah.
When did you get diagnosed with that?
I think it was in 2004.
Okay.
And then I also have the coronary artery disease, and that was diagnosed in 2014, I want to say.
Okay.
So that's more recent.
And then how did you get diagnosed with that? Did you go to just like a normal primary care physician for a checkup?
Yeah, and that's how they found it, through the screening.
Okay.
So, yeah. And I mean, that kind of stuff runs in my family too, so they knew I was at risk for it.
Okay.
Yeah.
Do you have any other medical diagnoses such as diabetes, hepatitis, COPD, thyroid disorders?
No, just the hypertension and the coronary artery disease.
Okay. Have you had any blood clots?
No.
No?
No.
Okay.
Although I did have a surgery. I had coronary bypass in 2010, which was a pretty big deal. And I had that at Thomas Jefferson Hospital. They were so good there.
Oh, were they?
Yeah, they were great.
Good. That's awesome. Do you by chance remember the name of your surgeon?
Dr. Goodhart.
Okay.
He was really made to do surgery.
Good. So you liked him? He did a good job?
Yeah.
All right. Awesome. Glad to hear that. Were there any complications from your coronary bypass?
No.
No? So the outcome was okay from that?
Yeah.
All right. Have you had any other surgeries in the past?
I actually have a pacemaker too.
Okay.
Yeah. And I've had that for about 20 years.
Okay. Do you know what hospital you were at when you got that put in?
I think that was also Thomas Jefferson.
Also? All right. Was that
Yeah.
also a good experience?
Yeah.
Awesome.
Yeah, it works great.
Good. Any complications with it?
No, I haven't had it checked recently though.
Okay. So when would you say was your last time you got it checked?
Probably a year ago. So I'm probably due for a checkup.
Okay. Not a problem. We can get that taken care of for you afterwards if that's something you're interested in. Alrighty. Have you had any hospitalizations?
Besides the coronary bypass, no.
Okay. And then any significant accidents or injuries?
I broke my leg in a minor car accident.
Oh no.
Yeah. Back in my early 20s, I think.
Okay.
So, yeah, it's well healed up.
And then what was the treatment you got for that?
Just cast.
Okay.
Yeah.
Any complications with that?
Nah.
No. Okay. All right. Any other accidents or injuries that you can think of?
Nothing significant, no.
Okay. Have you had any previous contact with psychiatric services?
Yeah.
Yeah.
I have anxiety.
Okay.
So I've had that for pretty much all my life.
Okay.
But just recently I started taking medication for that.
Okay, do you remember the name of that medication?
I think it's Lexapro or Lexapro or something like that.
Okay.
That's
do you know
just
the dose?
once a day. I think it's 10 milligrams.
Is that also oral?
Yeah.
Okay. All right. Do you remember the name of the psychiatrist that you go to see?
Yeah, it's Dr. Goodman.
Do you go to see him often, or was that like a one-time?
Like every 2 weeks I go.
Okay.
Yeah. It really helps my nerves.
Good. I'm glad that that's helpful. And at what age would you say you went to go see him for the first time?
I think in my 40s.
Okay.
Yeah. Yeah, we've had a long relationship. So.
Okay. So I know that this can be a sensitive topic for some of my patients, but have you ever had any experience with self-harm?
No.
No? Okay.
No.
Have you ever been admitted for your anxiety or any other psychiatric?
No.
No? Okay. All right. And then it's also important we ask about your gynecologic health as well. If that's okay, do you remember the date of your first period or how old you were?
Oh God, I think I was 12.
Okay. And then how would you describe your cycle?
Well, it used to be about 5 days with like a normal flow. It wasn't terribly heavy, it wasn't terribly light. I had really bad cramps. It's pretty average.
Okay. And then when was your most recent period, the last period you had?
Oh God, I started going through
remember that
menopause.
Yeah.
In I think like 55 I started
55?
menopause.
Okay.
So it's been I haven't had to worry about that in a while.
Okay.
So,
Have you had any complications or difficulties with going through menopause? No? Okay.
yeah.
Do you get routine pap smears? Yeah?
Yeah, my daughter takes me.
Have-
Same thing for mammograms too. She takes me for those.
Okay.
So.
That's great that you're on top of that. Those are really important. Have they found any abnormal findings on any of your pap smears?
No.
Do you have any history of STIs or sexually transmitted infections?
Back in my teens, I had gonorrhea.
Okay.
once, but that cleared up pretty easy.
Were you put on medication for that?
Yeah.
Okay. Do you
I
mind-
don't. No, I don't remember what, but
Okay.
it fixed
That's
it.
fine.
So.
And then, are you currently sexually active?
No.
Okay.
My husband actually just died not too long ago.
Oh, I'm so sorry to
So
hear that.
that's been a major stressor on me too.
Yeah. All right.
Yeah.
I'm sorry to hear that. Hopefully, Dr. Goodman may be able to help you talk about that if you need a support system. We're also here for you too if you ever want to talk about anything.
I appreciate it.
Yeah, of course. Were you sexually active?
Yeah.
Okay.
Yeah, I had 2 kids. They're great.
That's awesome. Have you been sexually active with men, women, both, or trans folk?
Just my husband.
Okay.
Yeah. Yeah, we were married for 50 years.
Oh, congratulations.
Yeah.
Were you comfortable in that relationship?
Oh,
like you
God,
were?
yeah.
Yeah. Okay.
He was a great man, great father.
Good, good. Was he your only sexual partner, or you?
Yeah.
Okay.
Yeah.
And you said you had 2 kids?
Yep.
2 living children?
Yeah.
How many pregnancies have you had?
I had 3. I did have a miscarriage.
Oh, I'm sorry to hear that.
Yeah.
Out of your children, were there any premature births, or were they all carried to full term?
No, they were full term.
Okay. Did you have any complications with that, or?
No, pretty standard pregnancies and deliveries.
Okay. Alrighty. And then you said you routinely get screening for pap smears and mammograms, right?
Mm-hmm. Yeah.
How about tuberculosis? Have you ever had a TB test done?
I had one in the past, but I haven't really had a need for it
Okay.
recently. So
What was the result of that test?
it was negative.
Okay.
Yeah. I was doing some volunteer work, so they had me do the screening.
Okay. Where did you volunteer?
A homeless shelter.
Oh, that's awesome.
Mm-hmm.
Did you enjoy it?
Oh, yeah.
Was that somewhere local or somewhere else?
Mm-hmm. Yeah, right across Philly.
Okay. Have you had a colonoscopy at all?
Not recently, no. It's been a couple years.
Okay. Do you by chance remember when your last one was, the year?
No.
No? Okay.
I just know it's been a while.
Were there any abnormal findings on that?
No.
Okay. All right, so just regarding your age, we think it's important for people to get colonoscopies every so often. So we'll check in with your charts and see when your last one was, and then hopefully maybe we can schedule for another one if that's okay with you.
Yeah, definitely.
Okay. So now I'm going to ask you about some family history. For your grandparents, did they have any significant medical diagnoses or injuries?
My grandfather had heart problems, but we didn't talk about that stuff back then. So
Okay.
I'm not quite sure what he had, but they just said he had like a bad heart.
Okay. And then was this your mother's father or your father's father?
My father's father. My mother's father, actually, he had diabetes.
Okay.
Yeah, type 2. So. And then I think my father's father died of like heart issues,
Okay.
but he was like in his 80s. It wasn't
Oh, okay.
anything. And I forget how my mother's father died. It's been so long.
Okay, that's
But,
all right.
Yeah.
What about your grandmothers?
My maternal grandmother, she just had hypertension, I think, but it
Oh.
was controlled.
Okay.
Yeah, again, like we didn't talk about that stuff back then.
Yeah. Okay,
So.
that's fine.
Yeah. And then my other one, she seemed healthy,
Okay.
but my dad also had heart problems.
Okay.
So, and he died of a heart attack in his, I'm gonna say, 50s. So that was a shock for us.
Yeah, I'm sorry to hear that. Do you know if he was taking anything for that, or
I don't know.
no? Was he aware of this problem beforehand, or
Mhm.
okay?
Yeah, he's always had heart problems.
And then what about for your mom?
She had breast cancer, but that's not what she died of. So she went into remission. She died in a car accident.
Oh, I'm sorry to hear that.
So,
You said she went into remission for
yeah.
that, though? Okay. All right, and then what about for your kids?
They're pretty healthy. My son also has high blood pressure, so I guess that
Okay.
actually runs in the family now that I'm thinking of it. But my daughter, she's healthy.
Okay.
Yeah.
Do they have any kids?
Mhm.
Yeah?
Yeah. Yep. I have 4 grandkids.
Oh,
They
congratulations.
each have 2 each.
Okay.
So.
Are they healthy?
Mhm. Yeah, they're great.
That's awesome. That's exciting. Probably
Mhm.
keep you on your toes.
Oh, yeah. All the time.
All right. And then just some other things about your social history, if that's okay.
Mhm.
Where were you born?
Harrisburg, Pennsylvania.
Oh, okay. That's not too far, right?
No.
And then how would you describe your childhood?
That was pretty good, you know, middle class family. My father was a businessman. My mom stayed at home. My siblings and I, we all got along, so
Oh,
it was
good.
pretty good. Yeah.
Good.
Finished high school. I went to college. I used to teach history.
Oh,
Mhm.
very interesting.
Oh yeah. Taught
What
that
grade did
for-
you teach?
It ranged.
Okay.
Yeah, just like middle school age. When they're the most troublesome. Someone's got to do it.
Right.
They were great.
That's awesome.
But yeah, I did that for I guess 50 years.
Oh, that's awesome. So you enjoyed it?
Mm-hmm.
Good. Good, good.
Yeah.